That's fine. Okay. All right. So we're going to start with the RAAS system because we're going to start with fluid and then we can understand electrolytes. What is the RAAS system? But what is it? Like, give me an example. Like what are we talking about here?
To regulate blood pressure.
Okay. So its job is to regulate blood pressure, right? Okay. Why is it so important to regulate blood pressure? What happens when your blood pressure goes too high? What's your worst case scenario? A stroke. What happens when it goes too low? What's your worst case scenario? Shock. And what is shock?
Where your kidneys fail.
All right. So where your kidneys fail. So what happens when you get too little fluid volume? Your body has to make some decisions. Where does it pull fluid away from first? Arms and legs, right? Okay. So what are they going to feel like? What is your assessment going to be when you notice your patient is getting hypovolemic?
Cold.
All right. So they're going to feel cold. What else? They won't feel tingly. Weak pulses.
Cap refill. Long.
Increased capillary refill, right? Because it's going to take longer for that. Those are called, all those symptoms together are called well, that's what's happening. Your patient goes hypovolemic. Yes. Okay. So why are we pulling away from arms and legs? You don't have to have them to survive, right? You have to have your brain, your lungs, your kidneys, right? You have to have these things to survive. So it's going to pull blood flow away from the non-essentials, right? Okay. So if this is cold and the pulses are weak, like what does that mean? That's what I'm asking you. That's what I'm asking y'all. These are signs of what? Poor perfusion. Blessings, y'all. Come on. All right. These are called signs of poor perfusion, which means your arms and legs are not getting perfusion, but that's okay. We can fix that, right? Or even if worst case scenario, we have to amputate. Can the patient still live? Yes. Okay. So that's why your body compensates that way. Are we clear? Yes. So now all the blood flow has been shunted here. So I can get blood flow to brain and heart and lungs and those things, right? Okay. But even at that point, it's like, I still don't have enough pressure or volume to perfuse everything. So now I have to pick something to pull blood flow away from. Where's the next place your body will pull blood flow away from? Which organs? Your kidneys. It's going to pick. Why would it pick the kidneys? Kind of rude. You could live without one, but they're the most resilient organ. They can come back even after being dead for a while. Okay. So it's like, okay, these are like our most resilient. I know they can come back. Like if I pull blood flow away from the brain, is it going to come back? No. Never. Okay. So the kidneys are like, they can take a punch. Okay. So it will pull blood flow away from the kidneys. And that is called shock. And the word we put in front of it is how you got that way. Okay. Which we'll cover in just a second. So once blood flow has been pulled from the kidneys, that is called shock. And then what happens after shock? Mod's death. What is MODS? Multi-organ dysfunction syndrome. Okay. So it's going to start pulling blood flow away from different organs that aren't being used. So it'll pull away from the gut, then it'll pull away from the liver, then it'll pull away from the lungs, it'll pull away from the heart. Not in those order every single time. Okay. But that is called MOD. So all of your organ systems are going to shut down and then you gone because it'll pull from your brain and then you don't have any blood flow. You have no glucose, you have no energy, all your cells die. Do we understand that? Yes. And that's how everybody dies in the history of all time, no matter what it is. You understand? Yes. Okay. So let's put a word in front of it just to make sure we can understand this. Okay. So let's say the patient is in hypovolemic shock. What does that mean? Low volume. All right. So they have lost blood volume in some kind of way, shot, stab, something. They've got to bleed somewhere, or they were super dehydrated, right? Like they haven't drank anything in 3 days and they've been vomiting diarrhea. Okay. So what's going to happen first when their blood pressure is like 88/48? It's going to pull from the extremities first. So when you do that assessment, it's going to feel like weak pulses and cold extremities. And what's it called when they get that weird, like marble look to their arms and their legs? Modeling. And then their cap refill will be increased. And those are called signs of poor perfusion. Y'all have got to get this. Okay. Signs of poor perfusion. Then what happens after it pulls from arms and legs? All right. Then it's going to pull from the kidneys. And that is called shock. What type of shock in this case? Hypovolemic, because they didn't have enough blood volume, right? Then what happens after that? All their organs start to die, which is called MODS. And then, yes, they will die, unfortunately. Okay, so let's put another word in front of it, okay? Anaphylactic shock. What is anaphylaxis? A massive, huge allergic reaction. So your whole entire body says, something is wrong, and you're going to vasodilate, which increases your capillary permeability, which causes Leaking into the third space or edema. Yes. So where's your fluid volume?
In your vessel.
Where's your fluid volume when you have edema?
Oh, in third
It's in the third space. Is it in your vessels?
No.
No. So what's your blood pressure going to do? Y'all, if there's no volume in your vessels, there's no pressure. Oh my God. Less volume, I don't know how else to get y'all to get this. If there's nothing in your vessels, how can there be any pressure? Okay. If your water hose is empty, how much water pressure do you have in it? None. If you have a ton of water in your water hose, how much pressure is there? Y'all seen a water hose go like this? Because that's a lot of pressure. Do you understand? Okay. So if all of your fluid is in your third space, how much fluid is in your vessels? Not a lot. So what's your blood pressure going to do? Go down. Do we understand? Oh my God. Okay. So then after the pressure goes down, right, then your body has to make some decisions. So it's going to pull away from arms and legs. What signs and symptoms will you see? I need some more details because I'm not sure you understand. Increased cap refill, weak pulses, cold, mottled. What do we call those? Signs of poor perfusion. Then where's it going to pull away from next? The kidneys, and that's called shock. What type of shock in this case? That is not what I said. Anaphylactic shock, because in anaphylaxis, on top of your whole body saying something is wrong, what chemical mediator comes out in anaphylaxis? In an allergic reaction, what chemical? Histamine comes out. What's histamine's keyword? It's a hole poker. So it's going to go poke all these holes in your vessels, causing more third spacing, right? Okay, so that is anaphylactic shock, right? So now your kidneys are starting to die. Then what happens after that? MODS, multi-organ dysfunction syndrome. All your organs are going to start dying, and then okay, do we understand that? We're going to do one more just to make sure that y'all are understanding this. Okay, let's do septic shock. What is sepsis? All right, infection of the where's your blood? Okay, so your whole entire body is under massive invasion. So your whole body says something is wrong, which causes you to vasodilate, which increases your capillary permeability, which causes you to leak into the third space, and that causes edema, right? So where is your fluid? Outside the vessels. Okay, so how much fluid is inside your vessels? Not very much. So what is your blood pressure? Very low. Okay, so if you don't have a lot of pressure, you don't have a lot of blood in your vessels, your body has to make some decisions. It's going to pull away from extremities first. You're going to see weak pulses, cold, mottled, yes, increased capillary, refill. Almost said refill. Okay, and then after it pulls away from arms and legs, which is called signs of poor perfusion, then it's going to pull away from kidneys, and that is called shock. And in this case, that is called septic shock. Okay, and then what happens after that? MODS, and then you gone. Do we understand? All right, I hope so. God bless it. All right. So the RAAS system is meant to keep all of our blood pressure intact, because if it's not high enough, then what's going to happen to our patient? Shock. Yes, we've done it 800 times. So if y'all did not say that, I was just going to walk right out again. Okay. So worst case scenario of low blood pressure shock, your threshold for like this is dangerous is 90/60. Anytime you have a blood pressure less than 90/60, that is very alarming. It's not high enough to reach up to your brain, because when you go, when your blood is pumping, it has to go against gravity to come up here, right? Well, with the super low pressure, it can't do that, right? So that's when it starts to become dangerous. Are we clear on that? So like when you go into pharm, every cardiovascular drug you have will say, hold for less than 90/60, hold the drug for less than 90/60, because you're going to bottom them out and cause them to go into shock. Do we understand? Yes. So the RAAS system's job, right, is to keep your blood volume in check so that you don't go into shock, right? Because you guys could just be sitting here if you didn't have a good RAAS system, like, I can't feel my arms and legs. Do you understand? Yes. Okay, so now we're going to go through each step of the RAAS system. All right, I'm going to kind of draw it as we go too. So y'all are going to walk me through it, okay? All right. Y'all are going to have to make some notes on this because I didn't put every single thing down for you. Okay. So how does your body know that there is low blood pressure? This is a vessel, by the way. How does it know?
Baroreceptors.
All right, what are baroreceptors?
They're inside the vessel.
Yeah, and they're constantly like little fingers that are like, what's your pressure? Okay, and then when it gets low, it's like, oh no, I don't like it. Do you understand?
Yes.
Okay, so they have these little, I need a better marker. There are these little baroreceptors inside of all your vessels, and their job is to sense your blood pressure. Are we clear?
Yes.
Okay, so They live like right in here. Okay, so when the baroreceptors are like, oh no, you have low blood pressure, then we have to fix it, right? Because we don't want this patient to go into shock. Yeah?
Yes.
Okay, so what happens after the baroreceptors sense that there is low blood volume? It starts this whole RAAS cascade, right? All right, so number one, what happens? The baroreceptors.
Tell the kidney and liver to release. What are they? Hormones?
Yeah. Okay. All right. And what do we got?
Renin.
Renin. All right. Where's renin produced?
Kidneys.
Okay. By the kidneys. And this starts a huge cascade of like boom, 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 right?
Yes.
Okay. So we got renin that gets released. Then what happens?
The liver releases angiotensin. I can't say that one.
Angiotensinogen. Okay. Which then makes you release what? Angiotensin 1. Okay. And that's going to convert to angiotensin 2. What is the conversion called? This conversion. What's the enzyme?
ACE.
ACE. What does ACE stand for? Y'all, are y'all kidding me? What are we doing? Converting what? Angiotensin. So it's called angiotensin converting enzyme. I'm gonna need y'all to get up or get some coffee or something this morning. This is the most painful thing I've ever done. Okay, so angiotensin goes to angiotensin 2 by way of ACE. Where is ACE produced?
Lungs.
In the lungs, which is very important when you go into pharm. And you will talk about ACE inhibitors, because what's the number one side effect of ACE inhibitors?
Dry cough.
Yes, it's a dry cough. Very good. You picked up my context clues too. I know I'm not sick. All right. So angiotensin 2 is going to go into 2 different cascades here. On one side, what happens?
Aldosterone is released.
From where?
Adrenals.
Okay, let's do that. What's aldosterone's job?
To
regulate sodium and water.
But how exactly? It doesn't regulate. It just.
retention.
All right. So it causes sodium and water retention. What does to retain mean?
Hold it in.
Hold it in. So it makes you hold in sodium and water. Now, why would it do that? What's the problem, y'all?
Yeah.
All right. The whole problem was hypotension, right? So if it helps you to hold in sodium and water, that's going to hold extra fluid in your vessels here. So it's going to increase the fluid in your vessels, which would do what to your blood pressure? More fluid, more pressure. Okay. So that's one, but they're like, hey, we're not quite there yet. I want to fill this vessel all the way up to the top. You understand?
Yes.
Okay. So what's on the other side?
ADH.
All right. Where's ADH come from?
Posterior pituitary.
The posterior pituitary secretes ADH. What does ADH stand for?
Antidiuretic hormone.
Antidiuretic hormone. What does to diurese mean?
Pee.
To pee. What does to antidiurese mean?
Not pee.
To not pee. Okay, so it's going to hold in what?
Water.
Just water. This is very, very important. Did y'all watch this video on YouTube?
Yes.
Okay, so y'all know this is very, very important when we do, because y'all know we did endocrine. Diseases are really, really important to know. ADH like is just water and aldosterone is sodium water. So now that I have secreted ADH, my blood volume I'm holding in water is going to be up here, but are we there yet? We're not to the top yet, right? Okay, so what is the other thing that ADH does?
Vasoconstrict.
It's a potent vasoconstrictor. Now, when I vasoconstrict, what does that do to my blood pressure?
Increase.
Why?
More fluid, more pressure. Well, like
less space.
Yes.
More pressure.
Okay, sure. So I want you all each to grab your neck like this, and I want you to squeeze it. Do you feel some extra pressure? Okay, yeah. So the more you press on a vessel, this is the only way I'm gonna get through to you. I feel like the more you press on a vessel, the higher your pressure is gonna go because it's squeezing that water hose or your neck or whatever you need to do to get this. Okay, so that means it's going to vasoconstrict. It's gonna squeeze down. Now are we full?
Yes.
Yes. Now in nursing school, it is vital to note that you will always choose fluid before pressors. What are pressors? Pressors. Drugs that press the vessel shut. Okay. But what happens if I'm trying to increase somebody's blood pressure? If their vessels are empty, they have a bleed, they have hypovolemia, and I press them, is that going to help me? No, because I'm pressing an empty vessel. So that's why the rule is fluid before pressors. So if I go and a patient's blood pressure is 80/40, what's the first thing I'm going to do?
Fluid.
Fluids. I'm going to give them a bolus of fluids, which will fill up those vessels. And then I'm going to give them a drug that is a pressor, a vasopressor. Vaso means Vessel. Pressor means to press. It is pressing the vessel. Do you understand? Fluids before pressors. Fluids before pressors. Got it?
Yes.
Cool. All right. Do we understand the RAAS system? Okay. Questions, comments, rude remarks? No? All right, then.